Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
I'm Dr. Joseph Chen. I'm a child psychiatrist working at County Westminster Children's Clinic for 23 years. I studied medicine at the National Taiwan University and graduated in 1976. I studied public health at Harvard University in 1982 to 1983. And then I had my psychiatry residence training at the UC San Francisco. And then I had my child psychiatry fellowship training at the UCLA, both in 1980s. And prior to joining the county, I was doing clinical teaching and research at the Chu Medical School for 7 years. And I spent 4 years overseas in Taiwan and 3 years at the Martin Luther King Hospital, Drew University in Los Angeles before I joined the county. And I joined the county in September 1993. And that was 23 years ago. Time flies. When I was high school senior students, I had a chance to visit an orphanage with my church youth group. In that experience, I saw that 50 kids live at that orphanage. A few of them suffered from polio and cerebral palsy, CP, so they were both physically and mentally handicapped. That experience really touched my heart strongly, so I decided to go to medicine. After medical school, after I finished medical school, I was interested in child development, and I also care about children and adolescent mental health, mental well-being. So I decided to choose child psychiatry as my specialty, and so far I have been enjoying my career in these 30 years. Orange County does provide a very good community mental health program for people living in Orange County, and especially for those low-income families. They can get pretty good quality medical care through the county clinic. And secondary, I like to say that my colleagues have been inspiring me a great deal. Like I have two psychiatry colleagues, Dr. Chen and Dr. Shanto Daich. Sometimes we consult each other for challenging cases. We talk about diagnosis, psychodynamic issues, and the medication treatment. So we support each other to deal with those tough cases. We also coordinate and schedule our vacation, and we cover each other. And I think whole clinic seems is a very cohesive team. So we work there, we help each other, and we have make a good contribution to our clients. Number three, I think I also have a lot of colleagues who are psychologists, clinical social workers, and MFT therapists. We work together as a team. We work very hard for months, for years, to help our clients to get better. And most of them, usually when they will recover from their medical and emotional problems. From my clinical experience, I'm very amazed to see that how much the medication treatment and the counseling, individual psychotherapy can help our clients, those kids and the teenagers to get better when they are in treatment. I think they suffer all different kinds of emotional and behavioral problems, like ADHD, like child abuse, trauma, related PTSD problem, separation anxiety, and depression. Even some kids suffer from bipolar disorder and childhood psychosis. And I think the whole team will work with them and to help them to improve in their young years. And I think when they turn adults, my experience is that the majority of them, most of them, will turn to mature and decent citizens.